Okay, so this is good day everyone. This is the continuation of our discussion in MRI. So in this video, we are going to discuss the image artifacts that are common in MRI. So actually, maraming uri ng image artifacts na present, but we will discuss only some of the most common na image artifacts na makikita natin sa MRI. So we have the motion-related artifacts, paramagnetic, Facewrap, frequency, susceptibility, clipping artifact, chemical shift, spike, and zebra artifact. So paramagnetic artifacts, so these are caused by the presence of metals or ions inside the body of the patient, or baka suot niya at hindi natanggal. The protons will not react to the RF excitation pulse and will therefore not be displayed. So in this kind of artifacts, so makikita ninyo sa images na parang may mga parts na missing. That is because in that area may mga presence ng metals or irons. Like for example, may splinter dito sa may upper left, may grenade shrapnel, may surgical clip, and may dentures. Next is the face wrap artifacts. It is sometimes referred to as aliasing. So this occurs when the FOV is smaller than the object. So masyadong maliit yung field size or ang field of view kaysa sa actual object, kaya nangyayari or nag-occur ang face wrap or aliasing. So ito yung itsura niya. So the wrap around artifact at the top, dito sa taas. So at the top, and dito sa baba, that is caused by aliasing artifact. So masyadong maliit yung kanyang field of view. Next is the frequency artifacts. So these are caused by dirty frequencies. So faulty, so dirty frequencies, so parang mga sagabal siya, parang noise. So faulty electronics, external transmitters, RF cage leak, yung Faraday cage niya, non-shielded equipment in the scanner room, metal in the patient, or when the door to the scanner room is left open, this can generate dirty frequencies. So parang mga unwanted signal siya, unwanted echoes na nadidetect ng ating receiver coil. So because of this, some problems. Next is the susceptibility artifacts. These are caused by local magnetic field inhomogeneity. So, hindi uniform yung magnetic field. So, pwedeng mangyari just like the one that are being encircled in red sa picture. So, parang nagre-reflect siya. So imaging at low magnetic field strength using smaller box cells, decreasing echo time, and increasing receiver bandwidth. So pwedeng ma-remedy, pwedeng ma-resolve yung susceptibility artifacts. Also, pwede rin gumamit ng gradient echo and echo planar sequences. I-avoid yung gradient echo and echo planar sequences para ma-avoid din yung presence ng susceptibility artifacts, because with the use of gradient, echo, and echo planar, pwedeng mag-increase yung possibility na magkaroon ng susceptibility artifacts. So instead of using gradient echo and echo planar sequences, so it is recommended to use spin echo, particularly fast spin echo sequences to avoid susceptibility artifacts. So iwasan gamitin yung gradient echo and echo planar sequences. Instead, yung gamitin ay spin echo, or if available, mas mabuti yung fast spin echo sequences. ito siya, susceptibility artifact. So, parang reflection siya. So, para maiwasan, ito yung mga kailangang tandaan. Another one is the signal clipping or overflow artifact or data clipping artifact. This occurs when the receiver gain is set too high during the pre-scan. Data clipping artifacts give images a washed out or non-uniform appearance as you can see sa picture. So kapag masyado daw mataas yung setting ng receiver gain during the pre-scan, so pwedeng mangyari yung data clipping artifact or signal clipping or overflow artifact. Another one is the chemical shift artifact. This is caused by different resonance frequencies of hydrogen in lipids and hydrogen in water. The chemical shift is related to the receiver bandwidth as well as the field of view. So when we say bandwidth, so it is the range of frequencies. So it is measured in hertz. So bandwidth is measured in hertz and defined as the range of frequencies involved in the transmission or reception of an electronic signal. So ito yung mga range ng frequencies na present when receiving an electronic signal, receiving and transmitting electronic signals. So minsan, makikita nyo kapag halimbawa nag-bog down yung isang site, so na exceed na yung kanyang limit, yung kanyang bandwidth na frequency. In MRI, the term may be used or bandwidth may be used to refer to the frequencies associated either with RF excitation, or which is the transmitter bandwidth, or signal reception or the receiver bandwidth. So in MRI, we have two types of bandwidth. We have the signal reception or the receiver bandwidth or the transmitter bandwidth or caused by RF excitation. So ito yung halimbawa ng itsura ng ating chemical shift. So because of the different contents of, like for example, hydrogen in lipids and hydrogen in water. Next, we have the spike artifact, which is caused by one bad data point in k-space. So yung k-space na na-discuss natin sa previous na video, so kapag magkaroon doon ng isang bad lines or parang may isang konting error lang, so magkakaroon siya ng spike artifact. Diba sabi ko nga, so parang mini-mirror niya lang yung sa kabilang side para mas mabilis yung pag-scan. So, ipaprocess din niya yung error na yon, i-reflect din niya dun sa kabilang side. So, k-space is a data acquisition matrix containing raw image data, yung mga lines dun sa previous slides natin, prior to image processing. So, magkakaroon siya ng spike artifact kapag may one bad data point sa k-space. So it is caused by one bad data point in k-space, and the figure below shows one data point in k-space which is out of the ordinary. The resulting image show diagonal lines throughout the image. So halimbawa dito, so may spike artifact siya because of one bad data in the k-space. So ito na yung magiging itsura niya. So isang bad data lang pero malaki yung difference sa image. So, ang remedy niya is to repeat the scan. And then we have the zebra artifact. So, this may occur when the patient touches the coil during the scanning or as a result of Facewrap. So, ito siya, parang zebra. So, those are the different types of artifacts. Most common lang. So, sabi ko nga, marami pang ibang klaseng artifacts na present sa MRI. So, some of the notes that you have to remember, mga important notes. So, yung images that appears dark on a T1 weighted image, increased water, just like in edema, tumor, infarction, inflammation, infection, and hemorrhage. Hemorrhage na pwedeng hyperacute or chronic ang cause. Low proton density also appears dark. Calcification and flow void also appears dark. And then, sa T1 still, so, ang appearance naman ng different structures na bright, fat, subacute hemorrhage, kasi pag hyper or chronic, dark siya sa T1. Pag subacute hemorrhage, bright sa T1. Melanin, protein-rich fluid, slowly flowing blood, paramagnetic substances such as gadolinium, manganese, and copper. Calcification appears bright but very rare because most commonly, ang calcification appears black sa T1. Laminar necrosis of cerebral infarction also appears bright on T1. So, minsan kasi sa board exam, ito yung mga tanong kung ano yung appearance ng certain structure sa T1 or sa T2. Next, sa T2 weighted image, so bright ang appearance ng increased water, as in edema, tumor, infarction, inflammation, infection, subdural collection. So, kanina, dark ang appearance sa T1. Pero sa T2, bright. Methemoglobin or extracellular and subacute hemorrhage. Dark on T2 naman, low proton density, parang opposite siya nung bright sa T1. Low proton density, calcification, fibrous tissue, paramagnetic substances, protein-rich fluid, and flow void. Okay, so tandaan lang. So, wala tayong mnemonics dyan. So, you can make your own para mas madali nyo siyang ma-memorize. So, different structures will appear differently depende kung T1 siya or T2 weighted image. They may be bright, they may be dark. So, also, in addition, bone marrow contains fat. So, therefore, it appears bright in T1 and dark in T2. WI stands for weighted image. Thrombus, sa subacute blood, so it appears white in T1 and white in T2 weighted images. Normal flowing blood, walang signal, so black in T1 as well as in T2. So, kapag walang signal, so black siya both in T1 and T2. Intervertebral disc, the nucleus pulposus, which contains water, appears black in T1. So, sabi ko nga, opposite yung T1 and T2. So, white in T2. The annulus fibrosus, so mature fibrous tissue, appears black in T1 and also in T2. So, we have here comparison of different MRI signal intensities. So, comparison between T2 weighted image, proton density using flare to suppress kanina yung fat, then T1 weighted image. So, solid mass, so bright, bright, dark. Cyst, bright, dark, dark. Subacute, bright, bright, bright. Okay? Subacute and chronic blood, subacute blood, puro bright. Acute and chronic blood, dark, dark, gray sa T1. Fat, sa T2 lang siya dark. Sa PD and sa T1, both bright ang appearance ng fat. Also, we have here a mnemonic. So, World War II. Water looks white in T2. Okay, World War II. Water looks bright or white in T2. So, water, white, T2. Fat-containing tissues are dark. So, kapag it contains fat, dark siya sa T2. This reverse is true for T1 weighted images. So, syempre, ang fat naman appears white sa T1. Damaged tissue tends to develop edema, which makes a T2 weighted sequence sensitive for pathology and generally able to distinguish pathologic tissue from normal tissue. So as mentioned sa previous video natin, so yung T1 is good for anatomy and T2 is good for pathology. Then last slide. So, ilang beses na rin itong lumabas sa board exam. Ito yung I bleed, I die, bleed, die, bleed, bleed, die, die. So, we have here intracerebral hemorrhage on MRI, yung appearance nila. So, we have several phases ng hemorrhage: hyperacute, acute, early subacute, late subacute, and chronic hemorrhage. So, yung time frame, pag less than 24 hours, hyper. Pag 1 to 3 days, acute hemorrhage. Pag greater than 3 days, more than 3 days, early subacute. Greater than 7 days, late subacute. And greater than 14 days, chronic hemorrhage. So, ito yung mga hemoglobin content. So, dito tayo mag-focus sa T1 and sa T2. So, ang hyper is iso, meaning the same, or hypo. Iso intense, meaning the same intensity or normal intensity. Hypo is below the normal or mas darker siya. Hyper is puti. Acute, the same, iso or hypo, pero sa T2, hypo din siya. Early subacute, hyper sa T1, hypo sa T2. Late, hyper, hyper. Pag chronic, parehong iso or hypo, katulad ng acute. So, based on T1 and T2 changes, so, I bleed sa hyperacute, I die sa acute. So, ang I stands for iso, B for hyper, D for hypo. Okay? So, B is bright, D is dark. Okay? So, iso is the same, or normal, or balance. Again, B for hyper. Yung bleed natin is B, then D is dark. So, sa T1, so, magkakasunod. Sa hyper, iso. And then, sa T2, black. So, bleed. Ang acute naman, iso din. Then, dark sa T2. Then, sa early subacute, we have bright sa T1, dark sa T2. So, bright, dark. Then, sa late subacute, parehong bright. Ito, hyper. Then, chronic, parehong dark. So, hypo, hypo. So, I bleed, I die, bleed, die, bleed, bleed, die, die. So, lumabas siya sa board exam ilang years ago. So, I hope makatulong, ma-remember ninyo. So, this is our last topic for MRI. So, thank you and good day once again.